Hi, my name is Amanda Poussard, and I'm a student nurse at UMass Amherst. A nurse can make a world of difference for a patient with something as simple as a conversation. After being in my psych clinical rotation, I have noticed that I interact more effectively than I used to with my patients. This video will display a patient situation that I experienced and would do differently if I had the chance to do it again, giving evidence to clinical learning. I used to be a sitter on a medical surgical floor before I had any clinical experience at all, especially experience with psych patients. There was one patient in particular that I got to sit with many times that summer. She had a medical diagnosis of chronic kidney disease in which she needed dialysis, but she was also suffering from schizophrenia and was hospitalized against her will multiple times due to self-destructive behaviors. At first, she scared me. Her psych diagnosis scared me. I was working one day when she had an episode in which she pulled out her dialysis catheter for the last time. From there, the doctors were not going to try to initiate dialysis again. I felt discouraged for her because even though she had a medical issue, the psychological issue often made decisions for her. The last day before I went back to school, I noticed she wrote on her board that her MD was Dr. God. She told me she knows she is dying soon. I had a hard time hearing that. I had grown to become friends with her. I told her maybe she isn't dying. I didn't know what to say. I never had such an intense experience before. I never had anyone trust me like her. She began telling me that day about her marriage at 18 years old to an abusive 50-year-old man. She told me how when she was growing up, her mother was too busy doing drugs to take care of her and her brother, and I never knew what to say, because every story she told me shocked me. I could not imagine that being someone else's reality. So I said nothing. I sat there closed off because I didn't know how to have an effective conversation. I didn't make eye contact because it was just uncomfortable for me. In our first class this semester, we discussed things that make us nervous about psych nursing, and so I said saying the wrong thing was what I was most nervous about, and it was because I had felt that I had said the wrong thing before. But that same day, we also discussed effective therapeutic communication techniques. We watched skits and I realized that I don't have to always know the perfect thing to say. The most important thing is to give positive support, listen, and show your patient that you empathize with them. If I could go back to that day, I would not discredit my patient's statement of impending death, but instead I would say, "Tell me more about how you feel about death." I would offer support. I would pay more attention to my nonverbal communication and sit there without crossing my arms or legs and leaning in just slightly so that she knew I was interested and open to talking. I would make eye contact because I'm no longer uncomfortable with having hard conversations. I would not be so afraid of saying the wrong thing, but instead I would ask about how she felt. I would offer myself as help to her to make her last days better, and I would not discredit the fact that she was dying, but help comfort her in the process. I now see that she wanted to talk about the trauma that she endured. I learned that sometimes someone to listen to is exactly what a patient needs. The literature supports the importance of having these positive conversations with patients when dying to help alleviate anxiety about dying. By doing so, patients feel like someone cares and therefore are more likely to have a peaceful and calm death. Psych Clinical has taught me not only how to have an effective conversation with a patient, but how to have a very difficult conversation. I've learned verbal and nonverbal skills to help facilitate these conversations. Nursing is not always about checking off boxes of a busy schedule, but taking the time to get our patient's entire story. To do so, therapeutic communication skills are essential, and because I have learned them, I will be a better nurse.